everybody. Today I'm going to speak to you about doll therapy and dementia, and I'm joined by Ella. Ella's my baby doll, and she's going to help me explain to you how it works. So the first thing I just want to touch on is just how prevalent dementia is now, and we've seen an increase in cases, and we will see a further increase in the next 15 years. And as people live longer, we're going to see more cases of middle to late stage symptoms, and these are what we call the non-cognitive symptoms, and they involve issues with communicating or expressing yourself, the feeling of restlessness or feeling worrisome or anxious, and feeling of being agitated or not being able to, feeling distressed. So the question is, how do we treat these symptoms? And doll therapy came more prevalent in the last 15 years. And it's a non-pharmacological intervention. What that means is it's not a medication, it's not a chemical, it doesn't bring about, a chemical reaction from a tablet. It's based on the premise of attachment therapy. And what that means is that the doll is the tool used to bring about an emotion reaction, hopefully a positive emotion reaction in the person, in order to soothe the person. It's not just baby dolls. There's pets, there's cats and dogs, and you can get electronic versions, so ones you put in batteries and they're quite responsive. But Ella is just a standard doll from a toy shop. With attachment therapy, you're hoping to bring about human behavior type qualities. So, soothing the baby, cuddling it, rocking, dressing, changing the clothes. Activities we would do with a real child. The big benefit for institutions or facilities is it's low cost compared to buying in tablets, and obviously you can reuse the dolls as well for other patients. So what are the benefits? Well, the benefits are it reduces the need for alternative medications to address these similar symptoms, increases the feeling of comfort the person and feeling safe. It helps their communication skills to help express themselves, encourages good social behavior, so eye contact, engaging, speaking, and it reduces carer stress. So when the patient or the person with dementia is feeling comforted and happy, generally the carer is happy as well. So how does it work? You present the doll to the person like you would presenting a baby. So you support the head and support the bottom. Generally, when you're holding a baby, you ask the person, what do you think about this? You don't address the doll as a baby. You don't address the doll as a doll. You let the person make up their own mind. Depending on what stage of dementia they are, they will either think that the doll is real, or they will know that it is just a doll themselves. You don't correct, but you just tell the person it is whatever you need it or want it to be. So who is suitable? Well, they would say that both men and females are suitable, but not all types of dementia. So if you have delusions or paranoia or hallucinations, this can be quite distressing and quite confusing for the person. The evidence, though, it's not all rosy. There are some cons to it. There's no formal clinical guidelines, so I don't have a manuscript or an instruction manual of how for you to use this exactly in a best practice way. There's a lack of really good, solid, grounded evidence on how successful or how good this is. There's issues with the ownership of the doll. So, if the person really likes it, they might not want to give it back, or they might feel distressed in regards of how can they care for it, how can they take over responsibility of feeding or caring for the doll. There's issues with consent. So if the person doesn't want to do it, it shouldn't be pushed on the person. Their medical history is obviously really, really important to know that beforehand, that they've had no trauma in relation to a child or to a baby. And obviously there's issues with prejudice. So you're giving the older person a doll or a toy that is appropriate to give to a young child. So you're not treating the person with dignity by giving them a child's toy. So when I spoke to the staff in St. Finbarr's, there was general mixed reactions. Overall positive. The main thing that they found was family engagement. So if the family was on board, it was more likely to be successful. The only thing they did highlight was that for any of the interactive dolls, so the dolls that require therapy, the responsive dolls, batteries cost a lot, and there was always a question over who would fund that. So the take-home message for today is doll therapy can be good, but it's not for everyone. There needs to be more research, and it's important that that doll therapy use is discontinued if it's not appropriate. If the person says no, it shouldn't be pushed. Thank you.